and then go into more thorough detail of how the heart functions. All right, and then the second part of the presentation will cover the network of blood vessels, which is the vascular system itself. Okay, so we're going to be covering some information today, but also she said make sure you're reading, make sure you know your terminology. It's very important. Okay. All right, so this is what she wants you to know. Every part that you see labeled here, you have to make sure you know the terminology. Okay, basic fact. Or you should know this. How big is your heart?
That's your fist.
The size of your fist. How many chambers?
4.
4. So that's not all you're going to be learning about. You're going to learn about every single part of the heart or state. So does she post the presentations onto Blackboard for you guys to have access?
Yes.
All right, so she said make sure you get the terminology for all of this. Okay, and that includes the pulmonary and peripheral circulation as well. Okay, as you can see, the outer part of the heart, you do see more vessels. Can anyone tell me what those are? What is it called?
Ventricles.
The ventricles, yes. Okay, so we're going to go into the cardiac cycle.
Vessels? Ventricles? Right.
Okay, so in the cardiac cycle, you're going to hear 2 things, systole and diastole. Okay, you also hear that in blood pressure. How many of you know how to measure blood pressure? Just one person? Jace, you don't know?
Oh. Yes.
What have you learned in my class?
You look at that.
I'm going to pick on you today.
With what?
Systole and diastole. What's the difference between the 2?
Systole is when the heart pumps the blood out, and no, backwards.
That's why it's just
Diastole is when the heart contracts, and systole is when the heart expands.
You said
almost,
systole.
no.
Systole is getting pumped out.
It's when it's pumped out.
What
it
if-
fills.
Can you not read it? No,
A lot of people think when the heart contracts that the blood comes in, that it's actually reversed. When it contracts, the blood comes out, but when it relaxes, the blood comes in instead on the right ventricle. Okay. So what she wants you to know, just besides those 2, is the intrinsic control. And I actually have a video that I attached. I was trying to look up a video to see if there's an easier way to explain it. So let me go ahead and see if I can get into it.
Action potentials originate in the sinoatrial node and travel across the wall of the atrium from the sinoatrial node to the atrioventricular node. Action potentials pass slowly through the atrioventricular node to give the atria time to contract. They then pass rapidly along the atrioventricular bundle, which extends from the atrioventricular node through the fibrous skeleton into the interventricular septum. The atrioventricular bundle divides into right and left bundle branches, and action potentials descend rapidly to the apex of each ventricle along the bundle branches. Action potentials are carried by the Purkinje fibers from the bundle branches to the ventricular walls. The rapid conduction from the atrioventricular bundle to the ends of the Purkinje fibers allows the ventricular muscle cells to contract in unison, providing a strong contraction.
All right, so very short video. What did you get out of that so far?
It bumps.
Okay, so intrinsic control, and there's also extrinsic
The
control.
cardiac conduction system consists of the following components. The sinoatrial node, or SA node, located in the right atrium near the entrance of the superior vena cava. This is the natural.
I hate YouTube sometimes. Okay, back to what we were talking about. Intrinsic control and extrinsic control basically means what? What is most familiarly known as? Anyone know?
Can you say that again?
Okay, when we're talking intrinsic and extrinsic control, because that's the next slide, I mean, this is like the thorough you can get. But overall, what does this explain about the heart? Blood flow.
Extrinsic is out.
Okay, yes, that's true. It's also known as heart rate. That is what determines the heart rate. Any questions so far? When I explain things, I try to make it as simple as I can. You know, like there could be a lot of details up here, but I try to make it as simple as possible. So when you hear about this type of control, it just basically means the measuring of your heart rate and blood flow as well. Okay, so any questions? No? Okay, let's move on. Okay, going into extrinsic control. Again, it deals with the nervous system, stimulated by hormones. What kind of glands secrete hormones? That's one of it, but the whole system, what is that whole system called?
That produces blood.
Starts with E. Endocrine glands, that's correct. Okay, so that's what also helps stimulate these fibers. Okay, so as I said, the heart rate depends on the balance of the nervous system of the parasympathetic nervous system as well as the sympathetic nervous system as well. Okay, and then what you're going to learn later on is there is a difference with blood pressure when it comes to aerobic versus anaerobic exercise. Okay, like the effect on systole and then effect on this diastole as well. All right, looking at the muscle, which is also known as the myocardium. Okay, now fibers contract simultaneously. Okay, and again, this is the initial way to create an impulse in the heart. Now, the left ventricle should have a greater wall thickness than it would with the right. Okay, why do you think that is? It does pump harder, okay? All right. And let me show you a quick video on that as well.
Thinking about a new career? Do something about it. The Milan Institute can help you reach your goal. Call 1.
Hey everyone, this is Matt from KenHub, and in this tutorial, we will discuss the definition, function, and anatomy of the myocardium. The heart is a large muscular organ that is comprised of 4 different layers. From the outside to the inside, they are called the pericardium, the epicardium, the myocardium, and the endocardium. Each layer has a different function that primarily aids the pumping action of the heart, which allows the blood to flow around the body. The aim of this tutorial is to highlight the myocardium. The myocardium is the middle muscular layer of the heart's walls. It lies between the endocardium and the outer epicardium. The myocardium has 3 functions: providing a scaffolding for the heart chambers, assisting in contraction and relaxation of the cardiac walls so that blood can pass between the chambers, and conducting electrostimulation through its own tissues and into the epicardium. This video is more fun.
Okay. So what's the function of the myocardium, the heart muscle? What is it capable of doing?
The heart.
Okay, contraction and force generation, just like you would with skeletal muscle. Okay. Do you guys have any questions? Are you understanding any of this? Yes or no?
Yes, ma'am.
Yes, okay. Just want to make sure. Okay, and also remember you're supposed to read. Okay, moving on. Electrocardiogram. What is that best known as?
ECG.
An ECG or an EKG. Okay, you can call it either one. All right, so she wants you to get familiar, like going through the book, she wants you to get familiar with how this is read. And when it comes to reading an ECG or EKG, like I say, you can call it either one. What matters the most is looking at these 3 areas. Alright, so I'm not going to get into too much detail, but she said you have to do that on your own. Alright, make sure to study up on this. Alright, and then how is it measured? Okay, actually, wait. Not in here. Okay, so in order to find out an ECG or EKG, like there's a formula that you could use to determine, and she said make sure to write this down if you are familiar with it. Sorry. Okay, so she said that's to determine the amount of blood pumped per minute. Okay, and again, this is determined by, as you can see, the heart rate and multiply that with the stroke volume. Okay, and I believe she will be giving you some case studies or like equations so that you can learn how to practice this. Okay, so if you're unfamiliar with what stroke volume is, she did put it up there for you. And it's categorized into EDV and ESV. Again, read that on your own. All right, and that's about it. Okay, she said not to go into too much, so it's your responsibility to read.
We are responsible.
Yes. Okay, ventricular volume and training. Okay, again, this is going into exercise of how it does affect your heart. So like I said, not going to go too much into that. So everyone has that, right, on their presentation. Okay. How to measure blood flow. Again, you should know this equation as well. It's the change in the pressure over resistance to blood flow. Okay, what do we call the disease in which there's a plaque buildup in the arteries?
Blood flow?
Nope.
Heart attack.
Nope.
Oh,
It starts with an A.
An A?
particular.
Cartilage.
I mean, it's an artery disease, so.
What's the second letter?
Not to tell you.
Particular.
That's only for high school. Arteriosclerosis. Okay, that's a plaque buildup in the arteries. Therefore, when it comes to heart attacks and strokes, heart attacks is where the plaque is built up in the arteries around the heart. Whereas for stroke, that's when there's a plaque buildup in the arteries leading to and from the brain. Okay, so make sure you know the difference between that. Okay. Yes, it's by cholesterol. There's 2 types of cholesterol. What are they?
No. No. Good and bad cholesterol.
There is a good and bad cholesterol, yes. We have the HDL and LDL. Okay, this is how you could differentiate between the 2. This is the healthy cholesterol. This is the lousy cholesterol. Okay, easy to remember. Okay,
Is that getting tested?
maybe. Like she said, don't say too much. Just try to go through the presentation as much as I can, but don't give away too much again, like she said. Okay, so any questions? Does that help? Like knowing the difference?
Happy.
Healthy and lousy.
Happy will work.
Okay, you definitely want your HDL levels to be high, whereas with the LDL, you definitely want to keep that low because that is what's responsible for the plaque buildup. All right. Systolic and diastolic blood pressure, what is the standard? 120/80 or lower, that is completely fine. Okay, they do have a high normal standard, and it's really not much cause of concern. I mean, pretty much the doctor would just say, hey, just look out, you don't want that to go any higher. But unfortunately, because of the habits of a lot of people around here, you know, isn't it true here in the state, there's a lot of diabetics, there's hypertension, high cholesterol, that sort of thing. All right, hypertension basically means abnormally high blood pressure, and it's divided into 2 stages. So when it comes to stage 2, if you should see someone's heart rate or blood pressure go over 160, that's already, I would say, that's already saying that the person could have a heart attack. All right? But when you're exercising and you see your blood pressure go that high, I mean, again, that could be completely different. All right, so any questions? Okay, exercise. As I mentioned earlier, your blood pressure definitely is affected when it comes to a certain type of exercise. What's the difference between the aerobic and the resistance, or what we call the anaerobic?
Aerobic is cardiovascular system.
You're using a lot of oxygen in the aerobics, and therefore an anaerobic what?
ATP.
Short bursts of oxygen, yes. Okay. So when you do an aerobic exercise, a lot of times if you were to take your blood pressure, like during the workout, especially when we do assessments, they take it at rest, during, and after. So if you see the blood pressure on the systolic side go up, then okay, your heart is working. Okay, but the diastolic pressure is not going to change as much, okay, when it comes to the aerobic exercise. Okay, however, with the resistance exercise, both systolic and diastolic pressure will be affected. Why do you think that could be? What's it? Any guesses or theory as to why? Why would the diastolic pressure be affected in strength training? I like to make people think.
The diastolic is when you pump blood back into the heart, right?
Heart goes back in, yes.
So,
Very good.
yeah, that's why.
That's right.
Well, no, all of
Okay. Again, just it has to do with the short burst of oxygen that's being used to and from. All right, and let's see. The more fit you are, the lower or the more stable your resting heart rate will be. I'm sure you guys know that already. So any questions? None? All right, so that's it for this first part. Now we're going to go into the second part. How am I doing so far for someone who wasn't even prepared? Huh? What?
Okay, awesome.
No, be honest with me.
He said better than Dr. Wall.
That is not nice.
Don't say you guys are thinking that.
Watch the camera.
It's on you. Just kidding. Just kidding, Dr. Wall.
Like you say back home. I'm from Guam, by the way, so.
Yeah.
That's right.
See who started it.
Tomorrow.
Samoa?
Half a day.
Who said happening? Oh, happening. Well, now. Okay. Did I go too fast on that one, or, I mean, it's just stuff you should already. All right, so the vascular system, also known as the network of your blood cells. Okay, now can someone tell me what is or are the major functions of your red blood cells? What are they supposed to do? They do transport oxygen, obviously we did right there. Okay, and where does our blood cells come from? In the bone marrow. That's correct. Anyone tell me what's the real color of your blood?
Blue.
Purple.
Okay. And why does it turn red?
Oxygen.
It's oxygen. Very good. Okay, plasma. What is plasma?
Plasma is CT. Isn't that the stuff that's inside the blood cells? Which is it? It's been a while.
I'm going to let you figure that out. Okay, even like when they take your blood pressure, or not blood pressure, when they take your blood, and then what they do is they put it in this machine and it separates the plasma from the blood itself. Yeah. Okay, and the table that you see on the screen, okay, just shows how parts of your heart is affected when it comes to particular types of exercises. All right, so there. Okay. Okay, now how to figure out how much oxygen is being given throughout your body. Again, it's another equation that you should be familiar with. And again, just showing you like where it should stand if you were to take it. Okay, and then how many of you have heard of the Fick equation? Okay, again, this is measuring the oxygen delivery in your blood through your body. Okay, so like she said, just just read through it, be familiar with it, because when she comes back, she's going to definitely test you on this. Okay. Okay, and then, let's see, factors. Yeah, she said not to go into too much detail with this. Everything is there for you already. Do you have any questions so far? This is actually very going into that area. I don't know why it's under faster. So any questions about that slide? No? Okay, let's go through some of this. Heart size. Okay, size of your fist. What happens if it's enlarged? Okay, obviously you will have a problem. Is it possible for your heart to explode?
Is it?
Just to let you know, it is possible. Okay, they did have a case like that before, and I didn't even know that until they did an autopsy. It said his heart, like, it's almost like literally just exploded.
Does it come from his blood or?
Yeah, it has something to do with the fibers in the heart and how it's overworked or it wasn't stabilized. So, yeah, there's different problems with the heart. I mean, there's still some things that they're still studying on. But yeah, I thought that was pretty interesting because I didn't know that was even possible. Okay, how do you measure your heart rate? Okay, you're counting your pulse, of course, and how long? For 1 minute, okay. Okay, what do you know about stroke? How is it different from heart attack?
Is that the end to the brain?
Okay, stroke is when there's a blockage in the arteries going to and from the brain, whereas with the heart, it's to and from the, or the heart attack is to and from the heart. All right, standard for blood pressure once more. Okay, and when should you start being alarmed?
140.
Yes, very good. Okay, and what are the tools that they use to measure blood pressure? No. They do have the monitors or the digital types, but those are not as accurate as the sphygmometer. Is that what you're looking for? Yeah, the sphygmometer. That's one way of saying it. So that will be the more accurate way to measure your blood pressure over the digital type. Especially if you're doing an assessment, Jace can tell you this. When we did a cardiorespiratory fitness assessment, isn't it true with the digital, it didn't really help? You know, like when we're doing like either the treadmill or the station or the cycle ergometry, and then we were taking the blood pressure, it kept saying error.
You have to make them stop and then do it.
Yeah, and it should be during, so the sphygmometer would actually be more accurate.
Good job, Jace.
Alright, I know it's short, but again, like I said, you know, I wasn't going to get into too much detail. But are there any questions at all?
Plasma?
What is plasma?
So
I'm
something.
not gonna tell you.
Come on.
Read your book. That's where they separate the plasma and, okay.
You look into this one?
What was the other one?
Hmm?
What was the other one?
Other what?
Like, you take the blood sample?
Yeah, it separates the blood cells from the plasma.
Yeah, well understand.
Okay, but no, it was very last minute for me to cover this class and,
You did a good job.
thank you. But you know what, I did want to go into more detail, but I was already told, it wasn't really Dr. Wall, it was Dr. Culpepper who said that you guys should read, again, make sure to have the terminologies done. And make sure to know the equations. Or Dr. Wall said know those equations as well.
Are you meeting teacher again on Monday?
No.
She come back Wednesday. Dr. Wall, when you come back?
Well, she should be back next week. Yeah, next week. But no, I'm not taking this class.
You're off.
I have my own classes.